Now we're going to treat the nuchal ligament. Now with this one, the nuchal ligament where I'll treat it is basically from about C7 all the way up to the base of the occiput. One we talked about was the nuchal ligament. So when I get in there and palpate the nuchal ligament, what I do is a couple things. First thing is I tuck that chin back in that first test on that glide, and then I drop this down. And a key component here is taking this top hand and coming over the top and supporting that. This allows me to get in here and palpate on this nuchal ligament and really feel where we're feeling some tension. It's very superficial and it really gives you good feedback. By giving that push back with here, it allows those patients that have some neck degeneration or disc injuries to hold into that position. And if you find that area that's not moving how it should, get in there with any type of instrument and start to break that down. I want this to be treated in a chair as well. It helps things relax. Now the setup has a couple components to it because we need to get these upper muscles to relax. So the first thing we're going to do is we're going to tuck the client's chin back just like that. That allows that to lock in. Then we're going to drop in just like that. Once we drop in, we're going to take our hand and put pressure back on the chair. So we're going to support that a lot because that gets that to open up because we want to effectively treat this area in here. So the key is getting that set up first. So when we set this up, it's all about gentle pressure. We're not jamming the head in there. It's very light and I'm very controlled, just like that, with that chin tuck first and then drop that in. And then the palm of my hand goes here. And I'm putting maybe about a pound or two of force. You're not pushing in there very hard, very nice and easy. That allows these muscles to relax and allows us to get an effective treatment on the ligament. So before I even put them in that position, I'll just get that lotion on there to open up. You don't want the client to be in these positions for too long because they are going to be very provocative and inflaming if there is some inflammation in there. So the lotion's on there. We're going to tuck that chin back like we said. We're going to drop the head in just like that. Palm is going to come on just like that. And then basically we're going to find that C7 and we know we're going to work all the way up here to the base of the occiput. Same thing with the instrument. So with the instrument, you want to be effective with it, but you don't want to get in there and do a lot of damage. So basically you're going to find your different areas. Here's one of the spinuses, here's there. So what you do is you sink in, back off, pull some of that. And what you're trying to find is where that area of grit and tension is. That's usually where that scar tissue is. And you can see each time I'm pulling through as I open that up, that allows that to open up. You're going to start by getting right in the middle here. Now some other areas you can get is out to the side here. I call it the gutter. And with that, you're going to use the flat part here, and you can pick up a lot in there as well because the nuchal ligament is pretty thick. So if I'm working that side, I'm going to bias my body over like that and pull up just like that. And if I want to get the other side, I'm going to come over just like that as well and pull up there. And what I'm feeling for is those areas of grit. Each time that I move it, I'm going to drop that head a little bit more, but I'm being very cautious to make sure I support the head and push that up against the chair. You have to treat this in a chair because it's going to put a lot of pressure on there. So the setup again, chin tuck here. And if we're working straight on, we're just going to be in just like that, holding the instrument and going like that. If we're going to get the lateral part over here, we're going to bias our body over just like that. And if we're going to get this medial side towards me, we're going to bias like that. Now, as we talk about, as the head drops, it's going to be a gentle drop. You're not going to force it. As you break down each layer of that scar tissue, it's going to open up some of that range of motion. So that head's just going to slightly drop. You're not trying to force it. If you force it, you're actually going to cause a lot of dysfunction in there and some extra pain for your client.